That has been in progress last year and this year has really impacted Hong Kong's non-Chinese ethnic community and has managed to reach over 1,000 people, helping them get dental screenings and allowing them to be put on a pathway to better oral health.
Important part is to make kids learn how to brush their teeth, and it's not going to be that easy to make them see, for which we try to generate them to have an active learning process where they try to brush the demo teeth. Active learning develops a curiosity among the children, and that also helps them grasp the brushing technique very easily, which would help them remember while they are brushing.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ। ਇਹ ਨਾ ਬਹੁਤ ਸੋਹਣਾ ਪ੍ਰੋਗਰਾਮ ਕੀਤਾ ਸਾਡੇ ਕਮਿਊਨਿਟੀ ਵਾਸਤੇ ਵੀ ਸਾਰੇ ਆਏ। ਤੁਹਾਨੂੰ ਪਤਾ ਬਾਹਰ ਹਾਂਗਕਾਂਗ ਦੇ ਵਿੱਚ ਦੰਦ ਵੇਖਣੇ ਬਹੁਤ ਮਹਿੰਗੇ ਆ ਤੇ ਇਹ ਜਿਹੜਾ ਨਾ ਮੈਂ ਨਹੀਂ ਵੀ ਇਸੇ ਤਰ੍ਹਾਂ ਇਹ ਕਮਿਊਨਿਟੀ ਵਾਲੇ ਕਰੀ ਜਾਣ ਵੀ ਆਪਾਂ ਸਾਰੇ ਇਸ ਤਰ੍ਹਾਂ ਵੇਖੀਏ ਤੇ ਸਾਨੂੰ ਇਹ ਸਰਵਿਸ ਗਵਰਨਮੈਂਟ ਦੇਈ ਜਾਵੇ। ਬਹੁਤ ਧੰਨਵਾਦ ਤੁਹਾਡਾ ਇੰਡੀਆ ਕਲੱਬ ਵਾਲਿਆਂ ਦਾ ਕਮੇਟੀ ਦਾ ਜਿਨ੍ਹਾਂ ਨੇ ਆਰਗੇਨਾਈਜ਼ ਕੀਤਾ।
What did you think of the event?
Excellent. Good turnout, good result.
We had almost 188 numbers.
Living here for 6 years, I've experienced that not many minorities are aware of any sort of dental services that are being provided by the government. So this is very handy for patients who might not be well language proficient, have volunteers from very different nationalities. So there's no sort of language barrier interfering with the health services.
So it's been a very pleasant experience. We have witnessed like a lot of participants who have come across from the different sectors live here in Hong Kong and different ethnicities. It's not only limited to only non-ethnic Chinese minorities, and we just do a general checkup and we advise to the best of our knowledge what we can help.
Great community. Everyone's friendly and nice. I am very excited to get my teeth clean.
I feel like I want to check my teeth. It is important.
Last year's camp I remember walking into a hospital and I remember banging into some people who actually I met previously at the camp, and then we referred them to come to Prince Philip Dental Hospital. So they went there for the screening and then we got to see them.
I think it's making a difference in the sense that one thing is that they're understanding that they do have some problems in their mouth. Maybe they don't know that. Second is that they're understanding that there are places they can go to and they're actually going for treatment there. So like all of us saw how many patients were there in need of treatment. Then I was more than motivated to work towards.
And empowering the NGO partners has been the goal of our previous project and this one. So we've been able to effectively partner with the India Association Hong Kong, the Pakistan Association of Hong Kong, as well as our other NGO partners such as Health in Action, and for this project Voices of Diversity. We are fairly confident that these NGOs will be able to make this project sustainable, which will be one of our goals with our next projects, where we will go back to collect evidence of impact and what work that the NGOs have been doing following our empowerment.
This is a good project, a preventive measure for the dental care and as well as general health. Since we have done the measurement, the blood pressure and also the blood sugar.
This is a very meaningful event, can help the FMRT to enhance their knowledge on the health. Yeah.
Quite surprised that with the number of the non-Chinese in Hong Kong, and I feel good that we can give them some awareness because some of them actually come from social economies. I think most of them come with some dental caries, and actually it is a preventable disease, and we hope that by our effort we can teach them how to brush their teeth properly, and when it's necessary they can seek for the treatment as soon as possible in order to prevent further harm.
I think my most special moment was having little kids come. Because like we haven't had much exposure to pediatric dentistry, but then like having little kids and then like their parents asking, oh, how's your outcome? I think that's really rewarding, seeing the little, and also like, and I think for these service projects, we get to have a lot more clinical exposure and also more bigger picture of what the general community's oral health is like.
Throughout the past few months, we organized 3 dental fairs. We had about 331 participants who were very happy with our dental fair project. They gave us an average rating of 4.65 out of 5. We've also noticed that a majority of the participants come from the age group of below 30 at 54%, while majority of them are also females with a 60-40 split. In terms of the districts that they come from, we've noticed that a majority of them come from Kowloon Island, New Territories, Hong Kong Island districts at 27%. Interestingly, we've noticed that there's not much of a significant difference in terms of their ethnic background, and we hope that with our future projects, we'll be able to empower NGOs in a more significant way to achieve the outcome that is best for the Hong Kong minorities.